Now we spoke about irrational use of drugs, and we said that irrational use of drug issues could actually come from both ways. Sometimes the person prescribing the drug could have the issue, that's a healthcare provider. Sometimes it's the patient that has the issue. So the healthcare provider could be that they are not really experienced, they don't really have the knowledge, so they prescribe the drug wrongly to the patient. Do you understand? Then also, it could be patient-related issue, as probably a patient was they prescribed a particular drug for you, but the patient was not following the prescription. So they went on and they were now using the drug as they liked. Or the patient is overdosing, simply thinking that if they take it so much, it will solve the problem faster. Do you understand? So how can we prevent the irrational use of drug? So of course, it's a multi-level approach. Do you understand? Multi-level approach. A lot of people have to, come in to ensure that this is actually achieved. So key strategies for prevention is what? Education and awareness. So public education campaigns to inform patients about the risks of self-medication and misuse. School programs should target all those adolescents that they are the risks of misuse drugs. And the healthcare workers should be well trained, because so that all their prescriptions will always be accurate. Do you understand? So rational prescription practice. So use evidence-based guidelines for diagnosis and treatment. Prescribe the right drug at the right dose for the right duration. Avoid unnecessary polypharmacy. So sometimes some issues don't actually require you using too many drugs. Do you understand? So you shouldn't use too many drugs when one drug will be enough. So regulation and policies, there should be strict control of prescription-only medicines. Okay? So that you don't find drugs that should only be prescribed in a hospital. If you find them in a pharmacy on the street and people are buying them anyhow. The pharmacovigilance systems to monitor adverse drug reactions and inappropriate use. So community and family involvement, you have to strengthen the family support systems to reduce vulnerability to drug misuse. Okay, so monitoring and evaluation, you have to conduct all those drug utilization reviews in hospitals and clinics, track the prescription patterns to identify what's the irrational use, then implement feedback mechanisms for continuous improvement. So I think that's what we got for the irrational drug use.